going to continue looking at Oklahoma's fragile safety net today. Bobbi Harter with St. Anne's Nursing Facility. Good to see you.
Good to see you.
All right, we've talked about mental health and addiction, substance abuse, homeless children, DHS waivers, all kinds of stuff like that. You run a nursing facility.
I do.
Tell us what we don't know about the job that you have to do and the residents and the concerns about what's been going on budget-wise in the state.
Well, I want to start by saying that, you know, people don't decide one day, oh, when I get old, I want to go to a nursing home, or when I get sick and I can't take care of myself anymore, I want to go to a nursing home. It's a much needed service. A lot of our elders have outlived their children, they've outlived their spouses, they're not able to go to adult daycare anymore or to be in an assisted living, and so then they come to us and we provide care until they go to be with their Lord. I think that in terms of nursing home residents, I think it's so scary when you realize that your home, your car, your belongings, everything that you have is going to be reduced down to a 10 by 12 room that you're going to share with a stranger that you don't know. And it's very sad when you think about it like that. So when you talk about going to someone who relies on Medicaid assistance in order to live in that environment because they have to, and you tell them, we're going to cut the funding and you're no longer going to have a home, now what do they have? Where do they go? Where do we put them? So it's a much needed service that I think that a lot of people don't realize unless you have somebody that lives in a nursing home.
For your residents, when they see things are going on, I know good people are trying to get this budget resolved and we're about to go into the new year. When you talk with them, what are their thoughts about the whole budget crisis situation?
They're afraid. They're terrified. They come and they say, where am I going to go? My children are gone. I've lost my husband. I have no home. That's the questions that you get. And as an administrator, I don't know the answer to that because you want to say it's going to be okay and don't worry about it, but in actuality, the cuts are significant enough that they're talking about. And although we've had a stay until April, the cuts are significant that a lot of these rural facilities where the majority of the patients are Medicaid, they will be forced to close. You're going to have you know, there's about 17,000 people in nursing homes that rely on Medicaid. Where are you going to put them all? A lot of facilities with these major cuts are saying, we're no longer going to take Medicaid patients. Where do they go? It's a crisis that's not going to just affect the people in the nursing home. It's going to affect us as a state. Oklahoma is already one of the lowest paying Medicaid rates. So we're already taking a hit when you take a Medicaid patient. So it's troubling to me as an administrator because your heart goes out and you want to say that everything's going to be okay, but in actuality, we just have a small breather until April.
Well, you do great work. Very nice to meet you. Merry Christmas to you.
Merry Christmas.
And thanks, Bobbi, for being in here.
No problem.
See this again at news9.com/yourvote.